We know that those in our community who share in the greatest wealth also share in the greatest health and health outcomes. And contrary to that, we know that those who share in the poorest health are often our most vulnerable populations. And so there's a definite difference based on income and how a person, how healthy a person may be. Sure, we see increased mortality in our lower socioeconomic groups. We also see increased morbidity, so those populations are getting disease at a much higher rate. We also see unhealthy behaviors in a lot of these populations, and so whether that be lack of access to healthy foods, lack of consumption of healthy foods, which is a lot different from lack of access, the lack of physical activity or adequate physical activity. We often see that in the lower socioeconomic groups or the less wealthy, as opposed to those who have more money, and that's for a multitude of reasons. For example, if I have a lot of money, then I may be able to shop at grocery stores that offer fresher foods, or I may be able to hire a chef to prepare those foods for me, or take cooking classes so that I understand how to properly prepare the foods, as opposed to a lower income person who may not have the availability of fresh fruits and vegetables, may not know how to cook those fresh fruits and vegetables, may not have the time to cook the fresh fruits and vegetables because they're busy working jobs that may take them into the evening hours or something like that. So there's a lot of reasons that lead to these differences in health outcomes, but we do see very different health outcomes between our rich and our poor, for example. I think it's always easy for someone who has wealth to speak to how easy it is to, or the personal responsibility piece. And yes, I agree that there is a certain amount of personal responsibility, but I also think that there's a community responsibility, and that as a community we need to provide the same opportunities to those who are less fortunate that the fortunate are able to receive. And so it is really important that we are making sure that our school systems are the same, whether you're going to an inner city school or you're going to a suburban school, and that the children in both schools have the same opportunities. We need to make sure that our children are fed healthy, nutritious meals, and so that they're not dealing with health complications in addition to having to do this. We need to make sure that children in our school systems are receiving health education and physical activity. And so if you're expecting a child from a lower socioeconomic status to be achieving at the same rate as a child from a higher income group, I think it's unfair if that child is not given the same or put on an equal playing field. And so we need to make sure as a community that we're doing those things as well. An example of the correlation between income or wealth and health inequities would be to look at the educational system. And in the educational system, we see that the income disparity for non-completion of high school was greatest among those families who fall within 100% of the federal poverty level. If we correlate that to educational attainment, we know that the further a person goes with their educational attainment, the healthier that individual is likely to be. So just to give you a recap, the healthier a person is highly correlated with the amount of education they've obtained. If you're driving across Grand Rapids, it's easy to see the wealth divides. And so, you can move from one neighborhood to another neighborhood, and you can clearly see the difference in the amount of money or the household incomes from neighborhood to neighborhood just within our own city. I think to some extent, people in our community aren't comfortable talking about the wealth divide that exists here. And not that it's bad to have money, because I'm not saying that to any degree, but that we need to make sure that our resources are spread apart, because it is an injustice for the wealthiest to have access to certain fundamental resources, and for the least of our community to not have access to those same fundamental resources. It's almost like, to some extent, it's more politically acceptable in this community to promote racial equality, so long as we don't draw explicit connections to class. And so it's okay to talk about race and how things are affected racially, but not but we don't want to talk about them when it comes to social classes or the wealthy in comparison to the poor. So oftentimes when we're looking at disparities or inequities in health, we tend to focus on them from a racial standpoint. But I would propose that we need to look at both race and income when we're looking at health inequities, because they both play a role, and race shouldn't be used as a sole proxy for income. Even though African Americans and Latino Hispanics are overrepresented in the lower socioeconomic status groups, we do see that income in and of itself is also an important factor to look at. So we see that it's not just a matter of race. We also need to look at income, because when you remove race from the picture, we still see very different health outcomes based on whether a person is rich or poor. And looking at the same picture, if you remove income, we see very different outcomes based on whether a person is black or white. And so we need to make sure that we're looking at each factor when we're addressing health inequities, and not just focusing on race and using that as a proxy for income. If I were to identify 3 ways in which I think Grand Rapids and Kent County can really move the bar in terms of improving health inequities, it would be 1, to really align resources. I think this is such a resource-rich community that we can align resources and get resources to the point where everyone in the community is able to share in the great wealth of our community. I think we need to have honest and open conversations with the folks who have the power and those who do not. And so we're talking about the haves and the have-nots actually sitting at the same table and discussing these inequities that are existing in our community. And then finally, I think that Grand Rapids doesn't exist in a bubble. And so there are other communities across the country who are also dealing with these same issues and coming up with innovative approaches to addressing these issues. And I think we can take or learn a lot from these communities and bring that back and give it our own West Michigan flavor and really move the ball.